Can everyone hear me okay? Great. Well, we're going to get started, and again, I want to thank the organizers here today. I think they've done a great job. There's a lot of need for something like this in Kansas City, and it's really a pleasure for me to participate and to be a sponsor. And I've got to be honest, I'm speaking on a topic that is near and dear to my heart because I think that choosing a fertility specialist, okay, great, thanks, is that better? Is a very important decision, and it's one that you need to be an informed patient and consumer. And I will admit I have a conflict of interest because I am very biased towards people seeing specialists because that's what we do and that's what we're here for. And really it's my privilege to be able to provide that type of medicine to you. There are many, many doctors that see fertility patients. In fact, pretty much anybody who sees women or men can claim to be a fertility specialist. There's no criteria. If you see a patient and you say, I'm a fertility specialist, you can make that claim. And if you look through the phone book or on the internet, there are many, many doctors who claim to be fertility specialists. But really, there are very few that have that type of training and background. If you're a family practitioner, most of them have no requirement to do any type of fertility teaching or training. If you're an OBGYN, you go through a 4-year residency. And during that time, you typically will spend at least a couple of months working with one of the reproductive endocrinologists. And back when I was in academics, I was responsible for teaching our residents the basic infertility evaluation, the basic principles of treatment. But I also told them, you are in no way experienced to provide most of the advanced things in infertility. And then, of course, the reproductive endocrinologists have a much greater training period. Right now, fellowships are 3 years long. And it's a very demanding, I don't want to say grueling experience, but you are completely immersed in training for 3 years. You work closely with a staff of reproductive endocrinologists. You make rounds, you work in the clinic, you operate with them, you perform IVF procedures, you do research, you attend rounds, lectures, you do journal clubs. For 3 years, you live, eat, and breathe reproductive endocrinology and infertility. And it's not all infertility. A good part of it deals with all of the intricacies of reproductive endocrinology and the hormones and the knowledge that is behind the infertility treatments that we do. Once you complete a fellowship, it's expected that you'll go on and get board certified. And the American Board of Obstetrics and Gynecology has, I think, one of the most demanding requirements for board certification of all fields of medicine. Following training, you'll take a comprehensive written exam that really tests your complete knowledge in that specialty. After that, the physician will submit a case list of patients that they have taken care of, both in the office, in surgery, and then also they will submit a thesis of original research that they performed during their fellowship training. You will then go to an oral examination. This is one of the most stressful times in a physician's life because you sit down with a small group of older, senior, board-certified physicians, and their sole intent is to find out if you know what it takes to be a reproductive endocrinologist. And it is not a 100% pass rate. And I would say almost all of us come away from the oral examination not knowing if we passed or failed. Fortunately, most of us do pass eventually. But the board certification is, I think, a very important stamp of approval. It really validates your experience, your training. It shows that you have mastered the principles of your specialty and that you're competent to provide that level of care to your patients. Once you complete your board certification, you're not done because now you have to go through recertification. Recertification used to be every so many years you would take a test and show that you were current in the literature in your field. Now the board has switched to where you will have to go through a series of education. So each year I get a list of articles from the board, ones that they've selected that they feel like all reproductive endocrinologists ought to know, and then a list of other articles that I can choose from that I find interesting or helpful to my patients. We take online exams. We have to complete modules where we take charts from our clinic, review them, and then take another look at the charts 6 months later to make sure, again, that we're incorporating those principles. And then there'll be periodic written exams. So, you know, becoming a board-certified physician and then being recertified, it demonstrates that you are current in your field. And if you have chosen not to be board-certified, or if you've not become board-certified, then there's no guarantee that your doctor has even picked up a journal since they left training. If you compare what can different physicians do in terms of fertility evaluation and training, I think most of these physicians can perform basic evaluations, documenting ovulation, checking tubal patency, checking a semen analysis. If the woman is anovulatory, most physicians can prescribe oral fertility drugs. If they feel that a laparoscopy is warranted, most OBGYNs can do that. But reproductive endocrinologists can go beyond the basics. And here is where I feel that that's why I'm here in Kansas City, and that's why the other practices are here. It's so that we can look for and discover whatever is affecting your fertility and offer the treatment specific to that. So most physicians can't do inseminations. They cannot or should not do in vitro fertilization. And most reproductive endocrinologists also have really extensive training in laparoscopy. And I'll tell you what, if you're going to go for surgery, you don't want your doctor to put you under anesthesia and then find something that they're maybe not comfortable treating, and then refer you to someone else who now has to repeat that type of surgery and then perform whatever is necessary. So those are some of the differences between patients, or I should say, between physicians who've been through fellowship training and those who have not. When you're looking at fertility clinics, obviously there's a lot of things to consider. Location, what are the staff like, what's the basic philosophy of that clinic. But I think it's important that you ask some real specific questions. Are the physicians, or is that physician there, are they a reproductive endocrinologist? Have they been through fellowship training? When was it done? And where was it done? Are they board certified? And not just board certified in OBGYN, but are they board certified in reproductive endocrinology? The American Board of OBGYN has made it easy for you to answer some of those questions. On their website, which is abog.org, they have a section that you can go to validate whether the physician you're looking at is board certified or not. All you need is the physician's last name, the state they practice in, and then you choose the block that says that you're a patient. And what will come up, and I use myself as an example, so now you know my middle name. It shows that I am board certified in OBGYN way back in 1989. That is current through the end of 2011, and we do it annually, so that's why it doesn't go beyond that. And also that I'm continuing in the maintenance of certification, which means I'm in the recertification process. I then got my reproductive endocrinology board certification back in '96, and again, I'm current through that. So you can check for your physician or the physician that you're looking to see. Here in Kansas City, there are a number of people that say they're fertility specialists. There are 8 physicians in Kansas City who are in 5 different fertility programs that offer IVF. Of those 8, 3 are board certified. Several are board eligible, meaning they're relatively new out of training and hopefully will become board certified. Several are no longer eligible for board certification. And I would venture to say that unfortunately many of the infertility misadventures that have come about, the octomom, the septuplets, they have occurred because those physicians were not fellowship trained or not board certified. And I wish that all of the public outcry about those situations would have focused more on the training of the physicians than on just the subspecialty. I think IVF is a very safe and effective procedure, and for certain couples that may be the thing that works best for them. And what's great about IVF is that the risk of a multiple pregnancy is really determined by you and the physician. You know, there is no reason to put in multiple embryos in most situations. So it wasn't the IVF procedure that was at fault. It was, unfortunately, the person making the decisions in that situation. In summary, then, I think it's important that you be an informed consumer. Find out about the practice that you're looking at. Find out about the training and certification of the physician. Make your choices wisely. Thank you very much.